Responsible for 27% of all cancer deaths, lung cancer is now the leading cause of death from both men and women. About 87% of lung tumors are associated with cigarette smoking, while the rest are associated with exposure to other environmental air pollutants such as asbestos, radon, and lastly, uranium. So we went out to ask a couple of unsuspecting people what they thought about consuming a few items that you could find in everyday life. Would you put this in your body?
Pink dinner? No.
Okay. Would you serve this to your babies?
No.
What?
No, not to my baby. Definitely not.
Alright, how about this?
Gasoline?
Is gasoline something you eat normally? Is that in your diet, regular diet?
No. You're going?
So you wouldn't put this in your body?
No.
Dude, that smells.
Really? You have it around the house?
Yeah. Mom uses it a lot because we have ants in our house sometimes, and I don't stay in my room until the smell's gone.
Yeah, true.
So you wouldn't breathe it in?
No.
Did you know all of those items were found or commonly found in cigarette smoke? So would you like one of these? Are you serious?
Yes!
Hey MTV.
Hey MTV, my name is Autumn,
My name is Beatriz, and I'm living with TB and homelessness.
and I'm living with tuberculosis and homelessness.
Minorities, the elderly, and the homeless in LA are especially at risk for TB. Poor living conditions often exposes them to a strain of bacteria, Mycobacterium tuberculosis, and with the stress your body is exposed to when you don't have four walls and a roof over your head, your body's immune system just can't keep up.
How exactly did you get tuberculosis?
That's a good question. I really don't know. To be honest, I think I've been hanging around Beatrice too much. Because she was spitting up blood and stuff. Like, it was so disgusting.
Who's Beatrice?
Beatrice is my friend off the block. Oh, I'm sorry. Beatrice is my friend from the shelter. I met her at that crowded place. When I met her, she was so skinny and she was spitting up loogies all night and sweating and stuff. And poor thing. I thought being homeless was bad. Being homeless and having TB, that's even worse.
When I lost everything, the only place I was able to go to was that overcrowded shelter in downtown LA. I mean, it was nice having a roof over my head, but when the room was housing 1 million people, it was kind of disgusting. And I'm pretty sure someone in there had TB, or what was it again? TD?
It's tuberculosis. It's TB.
TB.
So what does your average day consist of?
Well, like shopping, getting food, hanging out, everything you would normally do.
Just, outside in public without any money.
Anyone can be affected, but not everyone develops the active disease. In the lung, pulmonary macrophages typically ingest the bacterium and wall them off in tiny hard capsules called tubercules. The macrophages activate your lymphocytes or white blood cells, and within 2 to 10 weeks, the initial infection is controlled.
What? So what does that all mean? What?
I don't know. What does that mean?
Girl.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick.
So are you actually saying that we're all right?
Ugh. No, you two were definitely diagnosed correctly.
In 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
We'll be back after this commercial break.
Hi, my name is Beatriz and I'm living with lung cancer.
What's up, Beatriz?
Hi, I'm coughing.
So, what has changed about Beatrice since you've met her?
Well, she's lost a lot of weight, and I don't think she can keep up with us anymore. I think she's like fatigued, or there's something wrong with her.
I'm hemoptysis. You want to see it? It's pretty cool. But some people like to call me hemo.
My name is Dismia. I like messing with Beatrice. I just take her breath away.
Hey, my name is Fever. Whew.
And I'm chill.
I love messing with Beatrice at night.
Me too.
You know, whenever she sees me, she takes her blanket off, and then put it back on, then off, put it back on, and then she just sweats all night. She wakes up with a wet pillow. Chills.
That sounds fun. All she does is shake when I go visit her.
We met Beatrice when she was in college. Back when her smoking days were really bad. Us and lung cancer, we go way back.
Lung cancer always has her friends over.
Hey, and we're back.
Wherever she goes, we go. We're a package deal.
Hi, my name is Jeffrey Padilla, and I'm Beatrice's doctor. The treatment of lung cancer depends on the type and stage of lung cancer. Unfortunately for Beatrice and for many others, many people aren't diagnosed early enough for curative surgery. There are 3 types of lung cancer: small cell lung cancer, mixed small cell large cell carcinoma, and combined small cell carcinoma, small cell being the most aggressive. We can perform a pneumonectomy, a lobectomy, or a segmental resection depending on the extent of involvement. Radiation and chemo are often done in conjunction with surgery to enhance recovery. An oral drug called gefitinib or Irisa has been approved as monotherapy for non-small cell lung cancer after failure of first-line treatment with both platinum-based and docetaxel-based chemotherapy. The more you know. In small cell lung cancer, chemotherapy alone or combined with radiation has largely replaced the need for surgery because SLC is considered to be metastatic at diagnosis. A large percentage of these patients do experience a remission that is typically long-lasting. Post-op interventions for nurses typically go along the line of TCDB, incentive spirometer, all of that. Prescription medications may include anti-neoplastic agents to help just reduce the growth of the tumor itself. We can also prescribe antiemetics for nausea, antipyretics for fever, opioid analgesics for pain, all for symptomatic relief. Like, the best thing to do is just not having to deal with it at all. So what I suggest is to put the cigarette down, just say no. You don't need that kind of negativity in your life. You got it? Did you get all of that? You understood? It's okay, me either.
So TRU LIFE gave us these phones here to record our daily lives. I hang out here at the park all day pretty much with my dog Dio. And this thing here on my head I'm supposed to wear. But I don't like wearing it. I think it makes me look a little silly. Hopefully I didn't get my friends over here sick.
Oh, hey. So they gave us these phones to record ourselves. I don't know how to work this. Just got back from the clinic and got a free health screening. And seems like my TB isn't getting any better. So depressed. They gave me all these meds. I don't know what I'm gonna do with all these meds. Look at all these meds. What am I gonna do with all those meds? Do you guys think I take meds? No, I don't. The doctor also gave me a mask, but do you guys really think I'm gonna wear the mask? If I have TB, everyone else deserves to have TB too. Who? Shut up. I'll just go to sleep here, I guess. I don't know if you guys can see me. Good night, guys. And I'll try to have a good night and a warm night.
Autumn and Beatrice are doing a lot better now. Our foundation here at the was able to financially support their hospital stay as well as their drug therapy, thus rapidly declining their infectiousness. They're in their 9th and final stage of treatment, so don't forget to take your meds. Okay, I'm gonna start now. Ready? So, how is living now without TB?
It's good.
I mean, it's okay, but we're still homeless.
Yeah, I still live under the bridge. I feel a lot healthier. I mean, I'm not spitting out blood anymore, so that's good.
Anybody want to loan their house out?
I mean, we can cook for you.
I don't think.
What do you know how to cook?
Greens, beans, potatoes, tomatoes.
I can make you eggs.